Now, Cosatu has changed its stance on COVID-19 mandatory vaccination. President Cyril Ramaphosa has announced that a government task team is looking into making vaccination against the coronavirus compulsory for specific activities and locations. Joining me now is Cosatu's Deputy Parliamentary Coordinator, Matthew Parks. A very good morning to you. Thank you so much for joining us on Newzroom Afrika. Cosatu has now changed its position on mandatory COVID-19 vaccines. You say that your take has now evolved. How so?
Well, look, we must evolve. We must be guided by the material conditions on the ground, facing workers and facing our members and their families. We've been busy with the vaccination campaign for the past year, and many good work has been done. Many of our unions have been very active in the front to educate, to engage, to persuade workers to vaccinate. We've seen good progress amongst mine workers, police officers, teachers, nurses and doctors, obviously, clothing workers and many other workers in public service and the private sector. We've seen many of these workplaces have very high vaccination rates of 65% and above. But I think nationally we must accept we have reached a ceiling to an extent. We only have vaccinated 41% of society. We need to reach at least 80%, if not 90%, to really ensure we have defeated the pandemic, to manage further variants, etc. And so simply just persuading people to engaging them is not enough. It takes you so far. We need to go a bit further. So we do think we need to have a twin-pronged approach. One is to continue to engage and persuade people, but also to respect the rights of others to be protected. So we think we need to have a combination of approach. And our number one principle has to be about saving lives, the lives of workers, our members, the lives of the families. We've lost 90,000 people plus. We cannot afford to lose another 90,000. We lost 1.5 million jobs last year, and in the latest economic report yesterday, another 600,000 jobs have been lost. We simply cannot afford to lose 2 million more jobs. So we have a choice. If we continue this road of low vaccination rates, government will be forced to impose another lockdown to ease the pressures on hospitals. We can't afford that. That will destroy the economy. Well, unemployment is already 44% or 46% now. Or we have a choice that says all of us must now go and vaccinate. As simple as that. We have a choice between life and death, between being employed and unemployed. Our choice as Cosatu, our mandate from our members, has always been to defend their lives and their jobs. And the vaccines have been proven beyond a doubt by scientists, not by people sitting on social media, but by actual scientists, to be highly effective in saving lives. They've been shown to lower transmission rates, infection rates, hospitalization rates, death rates, etc. But also it's about for us showing solidarity to our health workers, because our health workers have borne the brunt of the pandemic. Thousands of nurses and doctors, paramedics have died. They continue to have to carry us on their shoulders. And as we enter this fourth wave, which is going to be a very rough and brutal one, they're going to be under huge pressure. If we are serious about showing respect to our health workers, to our nurses, let's all vaccinate to ease the infection rates, to ease the hospitalization rates. But also we're guided by the Constitution as we live in a democracy. And all rights in the Constitution are there, but all rights have limitations except one right, and that is the right to life. I have no right to impose my rights above your rights to your right to life. So it requires all of us to show solidarity to each other to vaccinate. Because even if you are vaccinated, if you're elderly, you have comorbidities, you have cancer, diabetes, or AIDS, or TB, you are still at risk. We've seen people in that vulnerable category still dying. So it's about us showing solidarity to our grandparents, to our elderly colleagues, to our vulnerable colleagues. We cannot impose our individual irritations or preferences at the expense of their lives. So I think for us, it's a crystal clear choice. We all now need to go out and vaccinate. We cannot afford to continue dithering and philosophizing and debating. We've had a year to assess the vaccines. The choice now is clear. We must move forward and must move forward quickly.
But other unions are still not in favor. They're talking about the workers' rights to choose, saying that those rights must be respected, also saying that they want to protect members from the repercussions of resisting the jab. This, of course, is speaking to the NUM, which has been very strong on their terms and what their thoughts are around mandatory vaccination.
Look, Cosatu recently had a central committee where all of our unions participated, and we all collectively, every single union agreed we must make sure every worker is vaccinated. That is a mandate from our central committee, which is a midterm Congress. We, in fact, set ourselves a target of ensuring that 80% of our workers are vaccinated and their families by Christmas. NUM has actually done excellent work in the mining industry. You can see in some mines you have a 99% vaccination rate. So unions are similar to lawyers. We'll always defend any worker, whatever the case is. We'll always make sure workers are not dismissed. But this is a fairly simple matter. If a worker is exposed to the pandemic, he must go and vaccinate. Employers also have an obligation under the Occupational Health and Safety Act to ensure that workers can work in a safe environment, to ensure that members of the public who go to those work premises are protected. And a worker will be within his rights or her rights to take that employer to court if they fail to ensure that they are safe. So we do appreciate that we live in a democracy, we have many views, even in Cosatu we have many divergent views, and that's healthy. And we know change is difficult, and as you go through change, people will raise concerns, we will debate, and that's good. But we must move forward as a society. And if you look at the history of pandemics and vaccines, it's always had this kind of engagements. As society moves forward, and we're better off for it. This is not the first time we've had a vaccine mandate. When our children are born, the hospitals vaccinate them for polio, for mumps, for measles, which are pandemics which also killed millions of people before. When our children go to schools, they are required by law to provide the vaccine clinic cards to ensure those parents of other children that their children are safe from deadly diseases. Similarly, when you travel to Africa, you're required to have a yellow fever certificate. So we always have laws in place. It does offend people. People raise issues, and that's good. Like when you don't allow drunk driving because it's a danger to society, when you don't allow people to drive without seatbelts. You remember when in Cosatu, Dlamini Zuma was Minister of Health in the early 90s after the 1994 elections. We put in place very strict smoking laws that you cannot smoke in front of your colleagues, on planes, in cars, in front of your children. People cried, they complained, they said, what about my rights? But we have to speak, what about the rights of the children? And so the same thing here. What about the rights of health workers? What about the rights of other workers? And we're getting many complaints from workers in the retail sector, in teachers, in the public service, the private sector saying, I am vaccinated, I've got comorbidities, my colleagues refuse to vaccinate, they refuse to wear a mask. Why is my life put at risk to entertain other people's philosophical debates? So we have to move forward to protect the most vulnerable of our community, and Cosatu has always been premised upon solidarity to the poor, to the vulnerable, and that's our mandate to take this forward. We are very confident we will move in that direction. We must move in that direction.
What would your position then be, seeing that you've had a change of heart on mandatory vaccination? Should one of your members say that they face the risk of losing their job because they choose not to vaccinate, how would you respond to that?
No, our unions across the board are engaged in such instances, and they have been, and we've seen many cases of the CCMA of such instances. And it's no different than any other workplace dispute or disciplinary action, whether a worker comes too late to work, whether the worker is not wearing the uniform, or there's some other story. We'll always defend those workers. We'll always seek to provide an alternative solution to discipline. We never are keen for any worker to be disciplined because those are parents. They've got children to take care of. But we would also urge these workers to say it is in your best interest to vaccinate, to protect yourself, and to ensure you can continue to work, to care for your family. We'd also want to convince that worker that this is about showing solidarity to your fellow workers who also have rights and families to take care of. But the response and the mandate from our membership has been very clear. We have long been supporting the vaccinations. We have long been engaged in convincing workers to vaccinate, and that's how we're going to continue. What we're simply doing is to enhance our campaign to make sure we can move from the 41% of vaccinations to 90% plus. We've complained bitterly, and the workers in the retail sector are feeling a huge burden right now when our borders have been shut by Europe because of the local variant. And that's going to continue because we're going to get variants every 3 months if we don't get our vaccination numbers up, if we don't deal with the pandemic. We have 1 million people who work in the hospitality and tourism sector. Those jobs will be at risk unless we get our vaccination numbers up. So it cannot be about one individual person's views because they saw something on social media versus the rights of millions of workers, the rights of the majority. We cannot pander to a minority and sacrifice the rights of a majority.
If you'll allow me to interrupt you, you've also said any restrictions going forward must be imposed on those who fail to vaccinate. You're speaking about the individual here. And you've also then said incentives and rewards should be used to encourage everyone to vaccinate. I mean, let's talk about the first part. Restrictions going forward must be imposed on those who fail to vaccinate. Are you saying that it should then become an individual sort of repercussion?
No, yes, exactly. And that's how it's been since the beginning of the pandemic. So no one is forced, by the way, to wear a mask. And no one will be forced to vaccinate. But if you want to operate in society, if you want to go to public places like shops, like the workplace, like public transport, like shopping centers, etc., you have to wear a mask. You have to sanitize when you enter those premises. You have to be screened. So we're simply saying, let's look at applying the same principles to vaccination. So when you go to a public place like a shop or a shopping center, you should also provide your vaccination certificate. So the same principle. So you're not forced to wear a mask, but that means you're then prohibited from entering public places. So I think it's basically the same principles. It's simply adding another tool in our fight against COVID-19. So we need to reward those who have supported government's sober health measures to deal with the pandemic. Let's allow them to continue with life, to go to work, to go to the shops, go out in public, etc., go to restaurants. But we also need to say to those who are not cooperating, well, there are consequences to that. Just like you have rights, you also have responsibilities, not just to yourself, but to society at large.
Okay, very well. Thank you so much for your time. Matthew Parks, Cosatu's Deputy Parliamentary Coordinator, giving us the change of heart when it comes to Cosatu's position on mandatory vaccination.